In this video, we'll discuss about purine nucleotide catabolism. In purine nucleotide catabolism, there is synthesis of uric acid. Here, synthesis of uric acid, increased or decreased concentration of uric acid in blood is related to different diseases. Purine nucleotide catabolism, there is synthesis of uric acid. Increased or decreased concentration of uric acid in blood is related to different diseases. That is, for example, gout, Less-Nigan syndrome, LN syndrome, then severe combined immunodeficiency, SCID, then purine nucleotide phosphorylase deficiency. So, what are the diseases? Gout, Less-Nigan syndrome, severe combined immunodeficiency, purine nucleotide phosphorylase deficiency. These are the disorder related with serum uric acid level. Coming to degradation of purine, this adenine and guanine, these are the purine. Purine means adenine and guanine. In metabolism, the nucleotide, that is adenosine monophosphate, inosine monophosphate and guanosine monophosphate. In the metabolism, the nucleotides, that is adenosine monophosphate, inosine monophosphate and guanosine monophosphate, they are acted up by the nucleotidase. This molecule acted by nucleotidase enzyme and converted into adenosine, inosine and guanosine. This is release of inorganic phosphate by the action of nucleotidase. So here, release of inorganic phosphate by the action of nucleotidase enzyme converted adenosine monophosphate converted into adenosine, inosine monophosphate converted into inosine, guanosine monophosphate is converted into guanosine. So, by the action of nucleotidase, here inorganic phosphate released. This AMP is converted into IMP, iodine monophosphate. AMP is converted into IMP. This adenosine is converted into inosine. AMP, with the help of enzyme AMP deaminase, is converted into IMP. Adenosine, with the help of adenosine deaminase, it converted into inosine. This adenosine deaminase is an important enzyme. Deficiency of this enzyme leads to disorder SCID, severe combined immunodeficiency. This SCID, first time on this disease tried gene therapy. Next, this inosine is converted into hypoxanthine with the help of purine nucleotide phosphorylase. This is released of inorganic phosphate is released of ribose 1 phosphate. Then hypoxanthine is converted into xanthine with the help of enzyme xanthine oxidase. Here, oxygen plus water molecules is released into free radical. This xanthine oxidase is an important enzyme. It is a metalloprotein. It is a metalloprotein which containing iron, FAD and molybdenum. It is important in uric acid synthesis. This reaction, water molecule and oxygen formation of free radical H2O2. Then this xanthine, again that xanthine oxidase enzyme, oxygen combined with water to form free radical, it will converted into uric acid. So this purine nucleotide degradation, in which AMP, IMP and GMP, which is ultimately converted into uric acid. This is the important enzyme xanthine oxidase. It is a metalloprotein containing iron, FAD and molybdenum. It is important in uric acid synthesis. In gout, that is hyperuricemia, serum uric acid both above 7 milligram per deciliter in the treatment of gout hyperuremia with patient allopurinol is the drugs of choice. So in gout hyperuremia along with the serum uric acid more than above mg per deciliter means treatment allopurinol. This allopurinol inhibits this xanthine oxidase by two mechanisms. First one is competitive mechanism, another one is suicide mechanism, and decreases uric acid level. This is all about degradation of purine nucleotide. There are 4 important disorders. Guanosine monophosphate is converted into guanosine. Again guanosine, purine nucleotide phosphorylase, then inorganic phosphate reduced into ribose 1-phosphate converted into guanine. This guanine is converted into xanthine, then xanthine to uric acid. Now we want to discuss 4 important disorders. First one is gout, in which there is uric acid production which leads to the accumulation of monosodium urate crystals in the joints. Treatment is allopurinol. Treatment of drugs of choice is allopurinol. In gout, uric acid production leads to accumulation of monosodium citrate crystal in the joint. So treatment allopurinol. Second one is LN syndrome, Leigh-Nelson syndrome. This disorder due to hypoxanthine guanine phosphoryl transferase. Deficiency of hypoxanthine guanine phosphoryl transferase enzyme. It is typically characterized by self-mutilating behaviors, and it's X-linked disorder typically occur in males. Also mental retardation in LN syndrome. This LN syndrome's disorder due to hypoxanthine guanine phosphoryl transferase. This one characteristic by self-mutilating behaviors, X-linked disorder occur in male, and mental retardation. Third disorder, severe combined immunodeficiency. It affects T cell and B cell function due to deficiency of adenosine deaminase enzyme. Here this one due to deficiency of adenosine deaminase enzyme. Fourth one is PNP, purine nucleotide phosphorylase deficiency. Also causes decreased uric acid level. So what is the normal level of uric acid? 3 to 7 mg per deciliter in males, 2 to 5 mg per deciliter in female. So gout and Ellen syndrome increase uric acid level. Then SCID and PNP decreased uric acid level. Suppose that level above 7, it's precipitated monosodium urate crystal. It affects joints in gout, metallocarbophalangeal joints affected. So this is all about purine nucleotide catabolism.